This is a Brooklyn-bound A express train.
The next stop is Grand Street. This is a Manhattan-bound B skip-stop train. The next stop is 21st Street, Queensbridge.
This is a Brooklyn-bound C local train. The next stop is 161st Street, Yankee Stadium. This is a Rockaway Park-bound C train via the A line.
The next stop is 59th Street, Columbus Circle. This is a Norwood 205th Street bound D local train. The next stop is 161st Street, Yankee Stadium.
Good evening. The latest UK case of coronavirus is the first to be contracted within the country rather than abroad. The man walked into a GP surgery in Surrey feeling unwell. It came as another patient who'd been quarantined on a cruise ship in Japan became the first Briton to die from the illness. The respiratory disease, which causes pneumonia-like symptoms, has infected almost 84,000 people in more than 50 countries. And although the vast majority of cases remain in China, the virus is now spreading faster outside that country. The World Health Organization says most, if not all, countries should expect outbreaks. Here in the UK, 20 people now have coronavirus, with Wales reporting its first patient. In a moment, we'll look at the effect of coronavirus on the global economy, and we'll answer some of the most pressing questions on how to manage the threat that the virus poses. But first, our health editor Hugh Pym has this report, which does contain flashing images.
Tonight, this GP surgery in Surrey was being deep cleaned after being closed to patients. A man who'd been in to see a doctor tested positive for the coronavirus. It's potentially highly significant as he hadn't been abroad. Health officials are trying to find out if he was in contact with anyone recently back from one of the worst affected countries. And in Japan, the first British fatality from the coronavirus. A man who'd been a tourist on the Diamond Princess cruise ship. After contracting the virus, he was said to have been very poorly. 5 Japanese people who were on the ship have also died, and more than 700 cases were diagnosed, with the ship quarantined earlier this month. 2 more people are being treated at the Specialist Infectious Diseases Unit at London's Royal Free Hospital after testing positive. A man from Swansea has contracted the virus after returning from northern Italy. the first case in Wales. There's been a surge in the number of calls to the NHS 111 helpline. Some callers have told the BBC of delays. An NHS source said people might have to wait longer, though the system was working. The government has sought to reassure the public.
The issue of coronavirus is something that is now the government's top priority, and I've just had a meeting with the Chief Medical Officer, the Secretary of State for Health and others talking about the preparations that we need to make.
Welcome.
The World Health Organization said the risk of a global spread of the virus was now very high, though containment was still possible. And around the world, countries are facing up to the growing challenge. Japan's Prime Minister has asked all schools to close from Monday until late March to prevent the spread. In Iran, the number of cases has gone up around 50% in 24 hours. 34 people have died from the disease. The main Friday prayers were cancelled for the first time in decades to contain the infection. New Zealand's health minister, meanwhile, has confirmed his country's first case today. And more worryingly, the first case in sub-Saharan Africa has been reported in Nigeria. The patient, an Italian citizen who flew into Lagos from Milan.
Well, this is the most worrying moment now in the whole crisis.
The former health secretary told me that school closures and sports cancellations might well be needed in the UK.
You can look at fellow democracies like Italy and Japan, and you can see that very dramatic things are happening. And we now have to make some choices, and I think the government is right to start to prepare us for some of those choices that we might want to make if we want to contain the virus at very low levels of penetration in the population.
To try to limit the virus spread, some Italian football's being played behind closed doors. The visiting Bulgarian team at Inter Milan last night wore face masks. The International Footballers' Union says it's concerned for the safety of players. Football, after all, is a global game, and this is a global health problem.
Hugh's here with me now. So, Hugh, we have the first person to catch coronavirus within the UK. Explain how that's significant.
Well, Rita, it's potentially very significant. This man hadn't been abroad, and public health officials are urgently trying to trace his contacts or a chain of contacts to see if one of them had been to one of the worst affected countries and recently returned, maybe without symptoms. If they can do that, they'll be reassured. What the very difficult situation would be is if they can't work out the transmission. That would suggest the virus is rather deeper rooted in the UK than they thought.
And there's more news tonight about the government's response.
Yes, Labour criticised the government for not having a meeting of the COBRA Emergency Committee today and simply saying they'd do it on Monday morning. I do sense a change in the government's approach. There will be measures announced over the next few days in terms of public information, a big new campaign encouraging people to wash their hands vigorously to prevent a spread of the virus. But also next week, Whitehall sources are confirming there could be emergency legislation as part of a package of measures, for example, to protect the NHS and schools if there is a serious escalation of cases. But that's a big if. The line in Whitehall tonight is still that current policies could still contain this virus.
OK, Hugh, thank you. Well, there have been sharp falls in global stock markets because of concerns over coronavirus. The total cost of this week's plunge in values has been more than $5 trillion. In the UK, the FTSE 100 closed the week 13% down. That's the biggest fall since 2011. The Governor of the Bank of England said it could mean the UK's forecast for economic growth being downgraded, and some fear there could be a global recession. Our global trade correspondent Darshini David reports.
Don't be deceived by the cheers. That's just the traditional way to mark the closing of stock markets on Wall Street. The truth is that shares around the world have lost the equivalent of 2 years of the output of the entire UK economy in value, just in the last week, squeezing investments such as pension funds. Reality has hit. Coronavirus isn't just a problem for China's economy, but for all our fortunes.
We would expect that world growth would be lower than it otherwise would be. We're not picking it up yet at all in the UK economic indicators, the survey indicators or other things. But if the world's slower than it otherwise would be, the UK's very open economy has an impact.
As outbreaks of the virus have multiplied around the globe, it's become clear that the economic disruption will be equally widespread. Now, from car makers like Jaguar Land Rover to electronics giant Apple.
Good evening and thanks for joining us. Countries and companies around the world are focused on COVID-19 tonight as new cases emerge. More than 50 countries have confirmed cases of the new coronavirus now, and the World Health Organization has raised its alert to the highest level. In Iran, there are reports from hospitals of a big spike in deaths, more than 200. That is 6 times higher than the official death toll from the Iranian Health Ministry. Many believe it's downplaying what's really going on. Mass disinfection is underway at mosques and on public transit. Schools are closed for 3 days, and many flights to and from Iran have been canceled. The World Health Organization now admits we are on the precipice of a pandemic.
This is the reality.
Good evening and thanks for joining us. Countries and companies around the world are focused on COVID-19 tonight as new cases emerge. More than 50 countries have confirmed cases of the new coronavirus now, and the World Health Organization has raised its alert to the highest level. In Iran, there are reports from hospitals of a big spike in deaths, more than 200. That is 6 times higher than the official death toll from the Iranian Health Ministry. Many believe it's downplaying what's really going on. Mass disinfection is underway at mosques and on public transit. Schools are closed for 3 days, and many flights to and from Iran have been canceled. The World Health Organization now admits we are on the precipice of a pandemic.
This is a reality check for every government on the planet. Wake up, get ready. This virus may be on its way and you need to be ready. You have a duty to your citizens, you have a duty to the world to be ready.
We'll get to what Canadian public health officials are doing to ramp up the response here in just a moment, but we begin with the stock market. It went into a tailspin again today across Asia, Europe, and here in North America. The TSX closed down 454 points, and Wall Street suffered its worst week since the financial crisis of 2008. The Dow Jones tanked today, closing a staggering week with a loss of about 3,500 points in just 5 days. It's all fueled by massive sell-offs and rising uncertainty as multinational companies downgrade their financial forecasts. Production at factories has slowed. That's paralyzing supply chains globally. And as more people stay home, stop traveling, and limit their activities to contain the spread, the pain will get worse. And tonight in the U.S., the world's second largest economy, the first hotspot for the virus is emerging. Jackson Prosco reports.
California is now the focus of COVID-19 containment in the U.S., where 8,400 people are being monitored for symptoms after a single person tested positive despite having no obvious connection to the virus.
This is a random individual in a community of 450,000 people.
The woman was admitted to hospital not far from a U.S. Air Force base where Americans were quarantined after their repatriation from Wuhan, China. A whistleblower has come forward to say staff on the base who greeted those Americans were not properly trained or protected.
Now that we're seeing it in essentially every continent, there's certainly, I think, a new attention being paid to this infection.
The lack of testing has hampered any clear sense of how widespread COVID-19 may be in the U.S. There are only a limited number of test kits. Many have been deemed faulty or unreliable.
It's going to disappear. One day it's like a miracle. It will disappear.
Yet the Trump administration continues to downplay the risk.
The reason you're saying so much attention to it today is that they think this is going to be what brings down the president.
Even as public health officials have warned the situation remains grave. Amazon instructed their employees to halt all non-essential travel. Google restricted travel to Europe and Asia after an employee in Zurich tested positive. Around the world, jittery markets continued their dive over fears of a crippling economic slowdown. In New York, the Dow and S&P racked up their worst week since the 2008 global financial crisis, wiping out trillions of dollars in wealth. While the U.S. Food and Drug Administration warned of the first supply chain shortages for at least one prescription medication. The U.S. plans to drastically improve its testing capacity within the next week, and that has officials bracing for more bad news. A sudden surge in detected cases could drastically change the outlook for the epidemic and further rattle already shaky markets. Donna?
Jackson Prosco in Washington, thanks. We keep reporting the number of confirmed cases as a measure of how this virus is spreading, but it's not giving the full picture. The only way to confirm a case is to test. No test, and you potentially leave human-to-human transmission unchecked. Disease mapping can predict what's coming. Experts at Imperial College London use Singapore as a benchmark. It was quick to impose restrictions on travel from China. It has a strict quarantine regime, and it's traced all contacts with infected people. It only has 98 confirmed cases and no deaths. So based on what happened there and looking at travel patterns from the origin of the outbreak in China, they estimate about 2/3 of cases worldwide remain undetected.
Italy, we think there are many thousands of cases probably distributed across the country now. And similarly and certainly in Iran, probably tens of thousands, if not more.
Many are likely people with mild or possibly no symptoms. But look at China. Some there are developing serious respiratory illnesses and dying. Not just the elderly and people with underlying health conditions. The mortality rate is uncertain, but COVID-19 does appear to be more deadly than the seasonal flu, and no one has immunity to it. And that's why Canada is now moving towards disease surveillance mode, not just passively waiting for people to show up at the hospital feeling ill, but actively looking for cases. Canada's chief public health officer has said it's similar to systems used to monitor influenza. And today, Ontario's health minister stressed the risk here is low, but preparedness is ramping up.
We actually have a command center that is set up. We are prepared. Our hospitals are prepared. We have the protective equipment we need to protect our health officials, and we are ready to move immediately should the situation change at any time.
There are 15 confirmed cases of COVID-19 here in Canada. All the most recent cases are in people who recently returned from Iran. The numbers are being updated by countries around the globe by the hour. Right now, there are more than 84,000 confirmed cases. South Korea's daily increase in cases has now surpassed that of mainland China. And Iran and Italy appear to be linked to the newest cases being detected far beyond their borders. Crystal Gamansing on the spread and the risk.
Nigeria has dealt with highly infectious diseases, Ebola, malaria, cholera, and now COVID-19, as an Italian man remains in hospital outside of the capital.
He's in high spirit, he's doing well, and we expect that he will continue to do well.
The 44-year-old recently arrived from Milan via Istanbul. Nigeria is home to more than 190 million people. A virus there can spread quickly inside the country and beyond.
The government of Nigeria, through the Federal Ministry of Health, has been strengthening measures to ensure an outbreak in Nigeria is controlled and contained quickly.
Authorities are getting a clearer picture of the web of infection. Italian cases are connected not only to Nigeria, but Mexico, Spain, Brazil, among others. Canadian cases can be traced to Iran. And then there's South Korea. A religious sect there has asked the public to stop persecuting followers. More than half of South Korean cases emerged after church members traveled to Wuhan. The World Health Organization is vigilant but still restrained in its language.
If we say there's a pandemic of coronavirus, we're essentially accepting that every human on the planet will be exposed to that virus. The data does not support that.
Meanwhile, as cases mount and the concern grows, COVID-19 has claimed the life of the first Briton, a man who had been quarantined on the Diamond Princess cruise ship. Crystal Gamansing, Global News, London.
All right, everyone, we have some distressing news to share. It is breaking news regarding the coronavirus. We're going to go right now to NBC correspondent Scott Cohn. He is a bit north of me in Sacramento. Scott, you've got this news. What is it?
The news, Alex, is that in Washington state, they are confirming now the first U.S. death from COVID-19. We do not know who this patient is. This is still rapidly unfolding. Remember that there was a case reported yesterday of a high school student who had no travel links to the disease. And then there was also a 50-year-old woman who had returned from Asia. We do not know yet, again, who this is, but the disease now deadly in the U.S. This as the FDA tries to loosen some of the restrictions on testing, which was one of the biggest issues out here, including the woman who is hospitalized behind me at the UC Davis Medical Center in Sacramento, who went several days without being tested. The FDA now loosening some of its restrictions, allowing some independent labs to develop their own tests and go ahead and implement them without FDA review. Only a relative handful of people in the U.S. have been tested thus far, as compared to thousands of people in other countries where this disease has broken out. So they are trying again to get on top of it. But again, the latest news now, this epidemic or pandemic is now officially deadly in the U.S., with officials in Washington state reporting the first death from COVID-19. Alex.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.
We start with the latest on the new coronavirus outbreak. The virus is spreading quickly across China and to other countries. And for more on this, our Kim Jae-hee is on the line for us. So Jae-hee, it looks like the death toll just keeps on rising.
Yes, Ji-yoon, the deadly coronavirus that first began in the Chinese city of Wuhan late last month continues to claim more victims. Chinese authorities said on Tuesday morning the death toll in China has soared to 106, and some 1,700 new cases have been confirmed compared to the day before. This brings the total number of confirmed cases in China to around 4,500. The deadly virus is popping up in countries around the world, spreading far from its origin country as well. Late on Monday, Germany confirmed its first case. Health officials there said the male patient is from Sternberg, a town some 30 kilometers southwest of Menin. The patient is reportedly stable, but the authorities did not elaborate on how he may have been affected. Germany is the second country to have confirmed the virus in Europe, following France, which has confirmed at least 3 cases so far. Beijing on Monday also reported its first death due to the virus. China's state-run CCTV said the 50-year-old man recently visited Wuhan and was confirmed to have the virus last week. A 9-month-old baby and a 4-year-old child in Beijing have also been confirmed, and a new case has been reported in Cambodia as well.
So how is the World Health Organization responding to this outbreak?
Yes, Ji-yoon, the WHO on Monday said there had been an error in its previous reports, which incorrectly said the global risk from the coronavirus was moderate. The WHO now says the risk is very high in China and high at the global level. The WHO last week decided against declaring the virus an international public health emergency, a designation only used for the most severe outbreaks. That is all I have at this hour. Back to you.
So at least 106 people have been confirmed dead. More than 4,500 cases confirmed in China. This coronavirus has spread out of control. Now, I did a video about the coronavirus yesterday, and I said that reports have came out saying that the coronavirus is getting stronger. That's false. It has already gotten stronger. What people need to do is keep hand sanitizer with them, wipes, wipe down doorknobs, wipe down sinks that are dirty. You need to kill bacteria. Make sure you have bleach. Wash your dishes in bleach. You need to make sure you and wherever you are is clean. Clean as a whistle. Purchase a mask. This hasn't hit America like it has hit China, but it will hit America. The American media is keeping this under wraps. They're saying that Americans should avoid going to China. I do believe it should be a step further. They should ban flights from China. This is going to get out of hand. And many Americans are out to lunch to pay attention to the times we are in, to what's going on. And there will be casualties here in America. And people will start taking this coronavirus seriously when it's too late. Now, China, they have taken this coronavirus seriously already. They are building hospitals within a month or two. They are bringing in thousands of nurses, doctors trying to handle this. People are being quarantined off from the public. This is crazy. And this is bigger of a problem than the media, well, at least the American media is reporting. This is a very, very serious problem that will have global implications. Now, the death toll is 106, but I don't believe any reports. I do believe it's higher than that. I don't believe anything the media tells me. This is why people should take their health, their security, their life in their own hands. Take this very seriously. I have masks. I have bleach. I have wipes. I have hand sanitizer. Make sure your home is squeaky clean. Clean up your home. Make sure you use hand sanitizer every time you put your hands on a doorknob or anything in public. Period. Take this very seriously, because when this hits America, it is going to hit America big. It's coming to America. Better believe it's coming to America. The media have already been caught lying. They're saying that the origin is from animals, is from China. No one really knows what the origin of this disease is, where it came from. But if you type in coronavirus, Arabian Peninsula, you will see reports of this back in 2012. So you can't believe what you are being fed on the news. You can't believe it. You have to. We are in a day and age where you have to take care of yourself. Period. You're going to have to do your own research. You're going to have to understand and read up what's going on globally. Period. You're going to have to cover real news. You're going to have to, because it may cost you your life. The time of shucking and jiving is over. It is real out here. People are dying. You have wildfires popping up all over the globe. You have the earthquake in Jamaica. You have the coronavirus. You have helicopters, planes flying in the sky and dropping like dead birds. We are in a time where you cannot rely on the news. You have to learn this stuff on your own. Period. No excuses. There will be casualties. You have wars, rumors of wars. This globe has changed, and for the life of me, I don't understand why Black social media has yet to catch on. It's good to talk about Kobe Bryant, to remember Kobe Bryant, to know what else is going on, but there is a lot of news that need to be covered. Okay? And you want to know what's going on out here. You cannot rely on the news anymore. You are going to have to know what's going on. Period. And if other people do not want to take this coronavirus seriously, they don't have to. You take it seriously. These movies that come out about the zombie apocalypse, Resident Evil, these movies about viruses, movies about finding a cure for diseases. This is real shit. We are living in a time where these movies are, in fact, true. They aren't just movies. They aren't just movies. I've seen very few black content creators cover this. The content creators who are covering this, they aren't big in the view category. But you know that black social media is not covering this. This is too much like right. It's too much like right to cover something like this. Covering something that have to do with life and death in black social media, black media, is not going to happen. So take this virus seriously and take care of yourself. I'm out. Peace.
Summons reporting from the Central Tower, Warden. The arsenal's secure, sir, and the men are all accounted.
Good. That was a wonderful job you did. Not a single shot fired, Captain.
Which may have been a mistake.
Next caller, me. I don't give a fuck what you think, bitch. Your thoughts ain't my thoughts. Bitch, I'm flowing straight from the survival scroll. Cut that bitch off. Next caller. Your thoughts ain't my thoughts. Bitch, I'm